Welcome back to the Health Lab. Today, inspired by the health and longevity ideas discussed by Dr. William Lee, we're exploring one simple exercise that may help adults over 60 support healthier leg circulation, stronger muscles, and better mobility. And the most important part is that you can do it right at home in just a few minutes. Stay with me because the movement I'll reveal could become one of the easiest additions to your daily routine. If you are over 60 and your legs feel heavier than they used to, your feet sometimes feel unusually cold, or your ankles become puffy after sitting for several hours, I want you to pay very close attention to what I'm about to show you. There is one incredibly simple movement that activates one of the most important muscle groups in your lower body. You do not need a treadmill, you do not need a gym membership, you do not need expensive equipment, and you certainly do not need to spend an hour exercising every morning. You can practice this movement while standing safely at your kitchen counter. And once you understand what is happening inside your legs when you perform it, you may never look at your calf muscles the same way again. Most people think about circulation as something controlled entirely by the heart. And of course, your heart is the remarkable engine responsible for pumping blood throughout your body. But getting blood back upward from your feet and lower legs presents a special challenge because that blood has to travel against gravity. This is where movement becomes extremely important. When the muscles in your lower legs contract, particularly your calf muscles, they can compress the veins running through the area and help move venous blood upward. This is sometimes why the calf muscle pump is described as a kind of second heart. It does not replace your heart, of course, but it illustrates just how important regular muscular contraction can be for healthy movement and circulation. And this becomes especially relevant as we get older. Think about how much of an average day can quietly disappear into sitting. You sit while eating breakfast. You may sit while driving. You sit while watching television, you sit while reading, you sit while talking on the phone, you may sit after dinner. Suddenly, what seemed like a reasonably active day contains hours when the muscles of your lower legs are doing very little. That does not mean sitting is inherently dangerous or that you should never rest. It simply means your body benefits from regular opportunities to move. Now, here is where many people make a mistake. They assume that because they are over 60, they need to protect themselves by avoiding anything that makes their muscles work. But maintaining appropriate muscle activity becomes increasingly important with age. Your ability to stand from a chair, climb a staircase, walk confidently through a grocery store, and recover when you unexpectedly lose your balance all depend partly on muscles that need regular stimulation. Your body does not stop responding to movement simply because you celebrated your 60th or 70th birthday. Walking remains one of the most valuable activities many older adults can do. So please do not hear this video as an argument against walking. Keep walking if it is safe and appropriate for you, but there are additional movements you can use throughout the day to specifically activate your ankles and calves. And the exercise I'm going to show you toward the end is one of the simplest examples. Before we get there, I want you to understand something that may completely change how you approach exercise after 60. Your goal does not have to be exhausting yourself. Your goal is to give your body a reason to remain capable. That difference is enormous. You are not training for an Olympic medal. You are training to confidently stand up tomorrow morning. You are training to walk into a restaurant without worrying about every step. You are training to climb the stairs when you need to. You are training to continue doing ordinary things independently. Start with something incredibly simple. Sit in a sturdy chair and place both feet comfortably on the floor. Keep your heels down and slowly lift your toes toward your shins. Then reverse the movement by lowering your toes and gently raising your heels. Imagine slowly pressing and releasing the pedal of a car. There's no need to move quickly. The purpose is controlled muscular movement. As your ankle moves, muscles around your lower leg contract and relax. Your earlier routine used this same ankle pump concept as an easy starting movement that could be performed while seated. This movement is valuable partly because it is so easy to integrate into everyday life. You could do a few repetitions while watching television. You could move your ankles after sitting at the breakfast table. You could gently move your feet after a long car journey once it is safe to do so. You are not trying to perform hundreds of repetitions. You are simply interrupting long periods of inactivity with movement. But we cannot talk about healthy aging by focusing only on the ankles. Your thighs matter enormously too. Sit upright in the same sturdy chair with your back supported and both feet on the floor. Slowly straighten one leg in front of you until it is comfortably extended. Pause briefly and then lower it with control. Switch sides and repeat. This deceptively simple movement activates the muscles on the front of your thighs. Those muscles help you perform something you probably did several times today without thinking about it. Standing up. Every time you rise from your bed, your sofa, your dining chair, or your car seat, your lower body has to generate enough force to lift you. When those muscles become weaker, ordinary activities gradually begin to feel harder. You might push harder against the arms of your chair. You might avoid stairs. You might start looking for something to hold before standing. These changes can happen gradually enough that people barely notice them. That is why I want you to stop thinking of strength as something that belongs only to young people. Strength after 60 is freedom. Strength is carrying your groceries. Strength is getting out of the car. Strength is walking through the airport. Strength is getting up from the floor if you need to. Strength is continuing to participate in your own life. And now we come to the calf muscles. Stand behind a sturdy chair or at a solid kitchen counter. This support is important, particularly if your balance is not what it once was. Place your feet approximately hip width apart. Keep your hands close to the counter. Now slowly raise your heels from the floor so that you rise onto the balls of your feet. Do not bounce. Do not race through the movement. Rise comfortably, pause briefly, and slowly lower yourself back down. You should feel your calf muscles working. That sensation matters. Each controlled contraction is asking those muscles to perform the job they were designed to perform. In addition to helping you stand and walk, contraction of the calf muscles helps compress veins in the lower leg and assist the return of venous blood upward. Your previous script also centers the supported calf raise on this combination of lower leg strength and circulation. But there is another reason I like this movement for older adults. Strong calves matter for stability. Your ankles and calves are constantly making tiny corrections while you stand and walk. You usually do not notice these corrections because your nervous system handles them automatically. But when strength and balance decline, those corrections can become slower or less effective. Imagine stepping onto an uneven sidewalk. Your ankle shifts slightly, your calf contracts, your hips adjust, your body responds before you consciously think about what happened. That little chain reaction may be the difference between continuing to walk and stumbling. This is why exercise after 60 should not simply be about how you look in the mirror. It should be about what your body can do when life surprises you. Now I want you to try another movement, but only if you have something sturdy beside you. Stand next to a kitchen counter and keep your hand on it. Shift your weight gently onto one leg and lift your other foot just slightly from the floor. You do not need to raise your knee dramatically. An inch or two is enough. Keep your eyes forward and breathe normally. If you can only hold that position briefly, that is completely fine. Put your foot back down, reset yourself, and try again when you are ready. The objective is not to prove anything. The objective is practice. Your previous routine uses the same supported balance concept, with safety and gradual progression emphasized throughout. Balance is not merely something you either have or do not have. It involves systems that can be challenged and practiced. Your feet, ankles, calves, hips, vision, and nervous system are continuously communicating to help keep you upright. Appropriate balance exercises give those systems an opportunity to work together. And think about what balance actually represents in your life. It means walking across your bedroom at night. It means stepping out of the shower. It means navigating a curb. It means turning around when someone calls your name. It means walking across an unfamiliar parking lot. These sound like ordinary activities until they become difficult. That is why protecting mobility should become one of your priorities as you age. Now we are ready for the movement I promised you at the beginning. It looks almost identical to the calf raise you just learned, but there is one small change: the pause. Stand behind your sturdy chair or kitchen counter. Place your hands on the support. Keep your feet comfortable and approximately hip width apart. Slowly lift your heels from the floor and rise onto the balls of your feet. Once you reach a comfortable height, stay there briefly. Hold. Feel the calf muscles contracting. Keep breathing. Then slowly lower your heels toward the floor. That is one repetition. Rise slowly, hold briefly, lower slowly. The movement should feel controlled from beginning to end. Your earlier script describes this final variation as a calf raise with a short pause at the top, specifically emphasizing the sustained muscular contraction rather than rapid repetitions. You might begin with only a handful of comfortable repetitions. There is no prize for doing 50. There is no reason to rush toward large numbers. Good movement matters more than impressive numbers. And I want you to remember those three words: rise, hold, lower. That is it. Something so simple can be easy to underestimate because we have been conditioned to believe exercise only counts when it looks difficult. We see complicated machines and intense workouts and assume that is what fitness means. But healthy aging is often built from much less dramatic decisions. Stand up instead of remaining seated for another hour. Walk when you safely can. Practice getting stronger. Move your ankles. Challenge your balance safely. Use your calf muscles. Repeat tomorrow. That may not look exciting on social media, but independence is built through repetition, not spectacle. Imagine yourself 10 years from now. Do not think about wrinkles or gray hair. Think about movement. Can you comfortably walk through your neighborhood? Can you get out of a chair without struggling? Can you travel? Can you play with your grandchildren? Can you carry your own shopping bags? Can you walk confidently into a restaurant with friends? Those are the outcomes worth training for. And you do not begin working toward them 10 years from now. You begin today. Your body adapts to what you repeatedly ask it to do. If your muscles are rarely challenged, they have little reason to maintain their capacity. If you regularly give them appropriate work, you are giving your body a reason to preserve function. This does not mean ignoring pain or pushing through serious symptoms. It means choosing consistent, appropriate movement within your abilities. There is something else I need to make very clear because circulation symptoms should never automatically be dismissed as normal aging. Persistent coldness in one foot, pain in the legs when walking, wounds that are slow to heal, or significant changes in the appearance of a foot deserve medical attention. Sudden severe leg pain or a leg or foot that suddenly becomes unusually pale, cold, numb, or weak can require urgent evaluation. Exercise is powerful, but exercise is not a diagnosis. If you already have peripheral artery disease, significant cardiovascular disease, serious balance problems, recent surgery, or another medical condition that could affect exercise safety, talk with your healthcare professional about what movements are appropriate for you. The purpose of this routine is not to promise that one movement can magically unclog arteries or cure circulation disease. No responsible health professional should promise that. The purpose is to help you understand how movement, calf muscle activity, strength, and balance can be incorporated into a healthier daily routine. And here's the motivational part I hope you remember after you close this video. Getting older does not mean becoming passive. Your age tells me how many birthdays you have celebrated. It does not tell me what you are capable of improving today. Maybe you are 62, maybe you are 71, maybe you are 83. Start where you are. If 10 repetitions are too many, do fewer. If standing balance exercises are difficult, use secure support and seek professional guidance. If you cannot stand comfortably, begin with appropriate seated movements. Progress is not measured by comparing yourself with someone 30 years younger. Progress is measured by what your body can safely do today compared with what it could do before. And never underestimate small improvements. One more controlled repetition matters. Standing a little more confidently matters. Walking a little more comfortably matters. Feeling stronger when you rise from your chair matters. Having enough confidence to remain active matters, because activity creates opportunities for more activity. When people feel stronger, they are often more willing to move. When they move regularly, they continue giving their muscles opportunities to work, and maintaining that cycle becomes increasingly valuable as the years pass. So tomorrow morning, instead of immediately thinking about how old your legs feel, think about what you can ask them to do. Move your ankles, straighten your legs, stand safely, activate your calves, practice your balance, then finish with those controlled calf raises, rise, hold, lower. Your routine does not have to be perfect. It simply has to become something you actually do. 5 minutes today is more useful than a perfect exercise plan that remains untouched on your desk. 10 controlled movements are more useful than promising yourself you will begin next month. Your future mobility is influenced by many things, some of which you cannot control, but giving your muscles regular, appropriate movement is something you can work on. Your legs have already carried you through decades of your life. They carried you to work. They carried you through difficult days. They carried you through celebrations. They carried you through airports, supermarkets, parks, homes, and countless ordinary moments you probably never stopped to appreciate. Take care of them now. Keep walking when it is appropriate for you. Keep moving. Keep building strength. And remember the simplest movement from today's video. Rise onto the balls of your feet, hold briefly, lower slowly, then repeat with control. If you are over 60, tell me your age in the comments and tell me whether you are going to try this movement today. Your comment may encourage someone else your age to start moving too. And if you want more practical videos about maintaining strength, mobility, circulation, and independence after 60, subscribe and stay with us, because aging does not have to mean giving up on strength. It can mean becoming more intentional about protecting it. Keep moving safely, keep taking care of your body, and most importantly, keep giving yourself reasons to stay active. Your future self may be very grateful that you started today.